Hi, my name is Shafiq. Today I will be talking about first aid for shock. But first, let's talk about the definition of shock to understand what is it actually. So by definition, shock is a disturbance of oxygen supply to the tissues and return of blood to the heart. Or in other words, you could also say it is a critical condition where there is a sudden drop in blood flow through the body. So what are the causes of shocks? Shocks can be due to trauma, blood loss, allergic reaction, severe infections, burns, heat stroke, and even more. The signs and symptoms include nausea, vomiting, fainting, tachycardia, tachypnea, the skin should be, you can observe it, it would be clammy, moist, you can feel that it's cold, and cyanotic, which has a blue tinge to it, especially on the lips. And now I'm just going to demonstrate to you how do we deal with a person in a shock. So for first aid in shock, we are going to go through the sign and symptom. So I'm just going to confirm whether the person is actually in shock. So I'm going to take a look at the skin. So the skin, right now the patient is in shock. It should be pale or cyanotic, especially the lips. And the forehead here, I can feel it. It should feel cold and also with perspiration, which is sweating. This one. Okay. So now I'm just going to check the mental status. So I'm just going to, sir, are you okay, sir? Sir. So that's mental, to assess their mental status. So right now the patient is unconscious. And now what I need to do is assign someone to call the ambulance. So I'm just going to point at someone and be like, hey you, in the blue shirt, call the ambulance. Okay, now that's done. One. And then we are going to proceed with ABC. So first, I'm going to do A, airway. I'm going to tilt the head back. Then feel the breathing. So right now, I can feel the breathing and I can hear it on my cheek. And I can see the abdomen is moving, it's still breathing, but a bit fast. Tachypnea, which is also a sign and symptoms. Then I'm going to check the circulation. To check the circulation, we're just gonna use 2 fingers, touch the trachea, and move towards you. So right now, pulse is present, slightly elevated, and regular. Then I'm going to make a conclusion. The patient is unconscious, breathing is still present, a bit elevated, pulse is still present, elevated, and regular. Do keep in mind that CPR might be necessary if the patient is not breathing and has no pulse. So there are some peculiarities when dealing with a shock. If let's say the patient is in shock due to blood loss, which is hypovolemic or hemorrhagic shock, we need to identify where is the wound that's causing the blood loss and actually deal with it first. So we need to perhaps apply a tourniquet, or at the very least, we put a bandage and then apply pressure on it to control the bleeding. But if let's say the shock is due to allergic reaction, maybe the person just ate a peanut or something like that, we need to prescribe epinephrine auto-injector or EpiPen. So we need to just use it accordingly if we know how. And that is all from me for now. Thank you very much for watching.